If you're applying to Katie Beckett but just don't know where to start, this video is for you. I'll show you exactly who to contact, which paperwork to gather, and the steps to make so that your application doesn't get stuck. Raising neurodivergent kids is messy, beautiful, and a lot. I'm Mary Ellen Yates, and this is Growing Together, Neurodiversity at Home. Let's figure it out together. Okay, let's get started. Okay, first, who to contact first? This answer could vary a little bit depending on one thing. Do you already have a psychological eval for your child? If you do, the first thing you need to do is contact the Katie Beckett office. This is their phone number, and have them send you the application packet. This took me a while to get. I called and left messages for multiple days, and I did not get a call back until I went back onto the Georgia Medicaid site and the Katie Beckett area, and I scrolled down, and there's a form to fill out if you want to contact them. And I filled out that form and said I couldn't get a hold of anyone. I was trying to get a Katie Beckett packet. And the next day, whether they called me back from the phone call messages I'd left or it was from that form, I'm not sure. But someone called me back the next day and we got the ball rolling. I gave her my email. She sent me the packet and it was all downhill from there. So that's the first step. Otherwise, you're going to waste a lot of time trying to find all of the pieces in other places, and they could add something or take something away that could make your packet still incomplete. The person that I spoke with sent me a handy dandy checklist that had items highlighted and checked off for the things that needed to be included in the packet, and I just submitted those things, and that was all I needed. In previous videos and other sites that I had gone to, it said that I needed other things, especially all my medical records for the past year for my kids, and I actually didn't really need that. All I needed were the therapy notes. Now, if your kid's in the hospital a lot, you will need the discharge summaries for the last year. But if your kid is just in a lot of therapies, you just need 90 days of therapy notes. Now, if you do not have a psychological eval for your kid, you need to find someone that can do that and call and make that appointment. I know for my kids, it took about 6 months from when I called to actually getting into the initial appointment, and then it was another couple of months between them doing the testing and getting the results from that initial appointment. So you definitely want to start that immediately because you'll need to submit that. If your kid is 0 to 5, they do a developmental evaluation, but the moment they turn 6, they need that more comprehensive psychological eval. Now, for my second son, he was just like 3 days away from being 6, so they did the psychological eval on him so that I wouldn't have to come right back. But since his birthday is right when the school year starts and he was a new first grader, they were not able to do the academic portion of the testing because he was not a reader yet. So now if I were to bring him in, they would be doing more testing on him because he can read now. So then after you get the packet, look at the packet, give yourself an honest timeline of how long you think it'll take to fill out the packet, which can vary for people depending on your ability. And then you're going to call your doctor's office to make an appointment and tell them that you need to submit the Katie Beckett paperwork for your kid's primary care provider to fill out. For us, it took a couple of weeks to get that appointment, and then it still took maybe a week or so after that appointment to get the paperwork back. Also, the office that we go to, they have a charge of $70 per application. So we had to pay $140 to get both of our kids' applications done with them. Okay, so for this appointment, I would suggest you watch videos on how to fill out all of these forms because you need to be well educated on what needs to be on these forms. And if you're going to be in a sit-down appointment where you can talk them through the forms, that's great. But for the appointment that we had, we came in and talked to the doctor, and then he gathered the paperwork, and then he took it to do at another time. And so when I brought the packet, I had Post-its all over explaining what to do. The Katie Beckett packet has instructions on each form and what the provider should be doing to fill it out. But these providers are very busy. They're not used to these forms. They often haven't watched the videos like you will be. And so they miss a lot of stuff. And then quite a few people handled the packet. So I had submitted the packet ahead of time, and then I went in for that appointment and they had all the paperwork. It wasn't filled out. But I noticed they had shuffled everything around and all my Post-its were in a different spot. So then the Post-its that I had left for the provider didn't really help him because they weren't on the same forms and whatnot, because other medical professionals helping them. So my suggestion and what I would do in the future, even though this seems overkill, I would do a sample application for each of your kids that has exactly what you think should be filled out in those boxes, to show them all the spaces that they need to fill out, because they really are supposed to fill out every single box. I was unavailable to pick up the paperwork once it was ready, so my husband went and picked it up, and he picked it up on a Friday, and I got it, and there were so many things that were not filled out. So then I had to call back on a Monday, asked to meet with someone again, and I had to go over every spot that they had missed and had them fill in those spots. So having one that's already filled out would probably be very helpful to them. So then you're going to want to contact your care providers for therapies, and also if your kid is getting any school therapies, you're going to want to contact all of those people and ask for signed and dated copies of their notes for the last 90 days. We just have 2 providers that we use. They have all of their documentation electronic, so it's pretty easy for them to send us the documentation in an encrypted file and for me to download it and then print it all off. So that was actually pretty quick. I received that within 1 to 2 days. If your kid receives a lot of nursing care, then you'd want the nurse's notes as well for the last 90 days. And then I mentioned before that if your kid has a lot of hospital visits, you're going to want hospital discharge summaries from all of those visits. You definitely want to be collecting those and saving those in a safe spot, maybe in a binder. Use those when you can, because it is a lot harder to contact the hospital and try to get the medical records, but you can do that as well. So as I mentioned before, one of the things enclosed in the email that the Katie Beckett person gave me was a handy dandy checklist that had all the things that they wanted included in the packet. Some of that is documentation or proof of things, and then other stuff is the actual applications. And then from there, I made a table of contents with all of the forms and supplemental information and all the documentation that I was submitting with them. I made a table of contents to show where all of those things were in the packet. So according to the packet checklist, I needed to show proof of income. So I sent a month's worth of pay stubs from my husband's employer. Next, they want proof that you're an actual citizen or have alien status, and there is a checklist with all the different forms of proof that you can provide to them. I sent a copy of my kid's passport, and I sent the birth certificate. I didn't have to send both, but I was just like, I'm going to give them everything they need so they can't say that they don't have enough. And then it also asks for their social security card, so I sent that as well. And the person that I spoke with on the phone said that you could just send copies of all of these documentations. I didn't have to have originals. It also says to provide any bank statements or any awards that your children have received. So if they have savings accounts, if they receive child support, or if they have any kind of funds, they need documentation for all of those accounts, because those are assets for your kid and they need to have that information to assess whether your kid is eligible for Katie Beckett, because again, they're looking at assets that your kid has, not what you have. So a lot of what I read online, and it mentions to supply the denial letter for SSI. And since I did go through that process, I did provide that. But on the checklist, I didn't see something that says show the denial letter. It just had show proof of your income. But that might be something to ask the representative at the Katie Beckett office if you need to supply a denial letter, because if that's the case and you haven't gone through Social Security, you will have to do that before you do your application. On the table of contents, I put in parentheses that my kids did not have any assets, so that they knew I was addressing it. I just didn't have any to send them. The Katie Beckett process has 2 parts. The first process is going over the application and making sure that the applicant has sent in all of the required documentation. And then the second process is that once that is verified, they send it to the medical reviewer team that has medical professionals that review the application. So about 2 months later, after I sent the Katie Beckett packet in, I received a call from the Katie Beckett team, and they were verifying some of the information that I enclosed in the packet, like the demographics. They also verified our household income, our social security numbers, They made sure that my kids had no assets in their name. And then they informed me that they were going to be sending the packet on to the medical reviewer team. So I'm going to briefly go over what is required in the application packet. I'm not going to go into detail because I will have another video that goes over each form. So this is just a general overview of what you should be expecting with this application packet. The first form was a health insurance questionnaire form. In the question that asks for their diagnosis codes for chronic conditions, I just said see attached, and I had that paper behind that application so that it could see all their diagnoses because my kids have quite a few. And then I also supplied the front and back of my insurance card, and then you fill out your insurance information on that form as well. And then these next forms your primary care provider needs to fill out, and these are the ones you're going to want to learn how to fill out and to help guide your provider through the process if they're not familiar with these forms. You might be lucky though, and they are, but if they're not, this will help them and you. And so there's the DMA 6A form, and this is the physician's recommendation for pediatric care. There are a lot of boxes. They need to fill out all these boxes, and this is where I had to go back to the doctor's office and had them fill in boxes that they skipped. Some of these boxes might seem like they don't apply to the kid, but they have to fill them out regardless. And then there's a TEFRA / Katie Beckett medical necessity / level of care form for them to fill out. They need to make sure that they're checking off the type of level of care you're applying for this kid. You're going to have one that is for nursing care and the other one that's for intellectual disabilities. And so depending on what your kid needs, if they have a lot of medical conditions and a lot of nursing care, that's what you're filling out. But if your kid has autism or some other diagnoses that require a lot of therapies, you're going to check off the other one. And you want to make sure that they're adding all of the types of therapies that they are getting. And if the therapy isn't listed, then they add that therapy so that it is documented. You want it to be clear that they are getting therapies at least 5 days a week. And when they say therapies 5 days a week, I found this terminology very vague, but it's really referring to how many appointments they're having per week. If your kid has occupational therapy in the morning and ABA in the afternoon, it's not just one day. They're getting 2 days worth of therapy. It's just all in one day, but it's 2 appointments. So that counts for 2 days, regardless if it's on the same day. So just to clarify that, they want the terminology days of the week, but it's really referring to the amount of appointments these kids are having for the different therapies. So, and then I have the TEFRA / Katie Beckett cost effectiveness form. I found most of this information on my insurance website, and then I typed it up and I gave it to my doctor so he could fill out the form with that information. He was pretty much transcribing that information onto the form. I also made supplemental forms for the DMA 6A form because they give you little tiny areas to write information, and some of these things they're asking for diagnoses. One of my kids has 20 diagnoses, so that's not going to fit on that form. So I had supplemental forms behind the form that answered those questions that it was asking. Some of those things that were on the supplemental documentation were medical history, level of care statement, diagnoses with the ICD-10 codes, medication lists, diagnostic and treatment plans, treatment procedures, and rehab services. I found Debbie Dobbs' webinar very helpful with how to create the supplemental documentation. And then I saved all of this documentation. So then for future renewals or future applications, I have all of this information and the format and layout already done, and I just need to update anything I need to update. So I'm assuming that the next time I have to go through this process, it's going to go much smoother because I'm already going to be ahead of the game because I have all of this already typed out. All these supplemental documentation that I did, I had my doctor sign each of them, or I invited him to create his own. An order of medical necessity is basically a letter on their letterhead, or some say that you can just have them write it on a prescription pad, but it pretty much says therapies that are ordered and how often they recommend them being ordered per week. And it's not necessarily what your kid is getting. So if your kid is only getting occupational therapy 1 time a week, but your provider really thinks your kid should be getting it 2 times per week, but you just haven't been able to find a provider that will do it 2 times a week, then they should put 2 times a week because that would be the ideal. even though that's not what you're getting right now. And then you can add that in your cover letter saying that they're only getting it once right now because we're still trying to find resources to provide that. Your kid might not be getting any of these therapies right now because you can't afford it. And so you're waiting to get approval before you even start any of this. And that happens too. So then this would just be an order of medical necessity of what the provider thinks your kid should be getting. And then you're going to submit that. And they can even add on there, my patient is not receiving this at this time due to these therapies being cost prohibitive, so that they know they're not getting them right now, but this is what this kid should be getting in a perfect world. So that is an end of what the provider needs to provide for you. And then you're also going to have the regular Medicaid application. You want to be filling out the application as the child, the applicant, and not as the parent. A HIPAA form needs to be signed. That HIPAA form pretty much discloses your right to keeping your information safe. And so you have to sign that form. It has all of your rights at the beginning, and then at the end it has a form to fill out. I was sent in the packet, it had the HIPAA form twice. I'm not sure why this is. This could be something else you could clarify with the person that sends the packet. I sent it twice because I don't want to be accused of not having it, because I didn't know if each department needed their own HIPAA form on file or if it was just a clerical error and they just accidentally attached it twice. I'm not sure. But I just signed 2 copies to make it so there were no issues. And then you're going to be attaching all of the 90 days of therapy notes. And they even have a paper in the packet that says you need to have all of this information. And so I just put all that information there. And then any other medical documentation, like all those hospital stays and all that, that's where this stuff is going to go. And you're going to also include your psychological eval in the packet as well. So what are some tips that may help you? Maybe would have reduced some of the snags and the denials that I got initially. So one of them would be if there's a lot of cancellations for appointments for whatever reason, having a cover letter in front of all of your therapy notes that says, these were the dates my kids could have had appointments, but they didn't, and list the reasons, because I ended up having to send that information later on. So especially if the reasons were you were waiting for authorization from your other insurance to continue therapies, or your providers are canceling, or your kids are sick, you just put all that in there. So then they know that you're being consistent. Some resources that were very helpful for me were the Debbie Dobbs website and also the Gina Deaton website. So you can check those out too. And then you just want to get out your application as soon as possible, because the dates on your application are the dates they're going by, that 90-day window before notes expire and all that stuff, and they want to see new things. So make sure that you're sending out your application as soon as you can after you receive all of the documentation that's filled out correctly from your doctor. So I just waited to sign all my stuff until I got all the doctor's information. And so I hope this helps. Have you gone through this process and have any other suggestions for parents? Or was your story different? I would love to hear about your experience in the comments. And I'd appreciate it if you like and subscribe below. And I'll talk to you later. Bye.